between Eastern and Western medicine. You are a medical doctor, but have a passion for preventative wellness. Why are you so passionate about holistic healthcare?
Well, thank you for the opportunity to speak to all of you, and thank you. I feel so loud. Am I too loud?
No.
Okay. Well, it's almost my life story. If I go back and I think about this, when I was 17 or 18 and I was in college, I always joke. I say, hi, my name is Michael, and I am a junk food junkie. I mean, I love junk food. I mean, most of us probably in the audience do as well, and most of America, as you well know, loves junk food. It was a very sad day for me when Hostess closed its doors this morning. So here I am. I'm in the School of Public Health and Human Nutrition, and I was eating 8,000 calories a day. Wow. 8,000 calories a day. I was playing semi-professional racquetball and touring the country playing racquetball, sponsored by a company, and going to school. And the only person who ate more than me was a hockey player for the University of Michigan team. I ate more than most of the football player people ate at U of M. And then there was me at 8,000 calories a day. But that 8,000 calories a day was pizza, nacho cheese, Doritos, and Coca-Cola. Like my favorite foods, right? Go blue. So I think it was really at that time I had an awakening of the type of food that I was putting in my body was just not good, right? And it was also at the same time that I started realizing that all of America was doing things kind of like this. And I was never fat. My body mass index was always less than 25 and things of that nature. So I was always pretty healthy and exercised a lot, but I really did not eat clean foods. And America is certainly in crisis, and I know we're going to probably have a chance to talk about that in a little bit, but it was about that time I realized that, number one, doctors know nothing about nutrition, yet we give you advice. You've seen doctors who smoke, you've seen doctors who are overweight. I mean, you know, it is what it is. And you've seen doctors who don't exercise, don't get enough sleep. It's the rest. We're just like the rest of America, yet we're giving you advice. And we know nothing about nutrition. I went to the University of Michigan undergraduate school of Public Health and Human Nutrition. Then I went on from there to medical school at the University of Michigan. And guess how many hours of lectures in the 4 years that we received on human nutrition? Anybody know?
0.
Zero is a very good guess. It's wrong. A little bit more. We had 3 one-hour lectures on human nutrition in 4 years.
Oh my God.
And here we are giving you advice about what to do. You know, my chiropractic friends, and we now employ them in my health system, you know, have 6 weeks officially of training, which is significantly more than us. And many of them go on to learn even more. And so there's people who know so much more about nutrition. And I realize that, you know, Hippocrates got it right. Let thy food be thy medicine, let thy medicine be thy food. And you have to put the right fuels in your body to be healthy. And it was really at that time that I started to come along and do this. And now I work for a health system, you know, so I started making supplements at the time. It was really the creation of the BiPAP. We got patents and things of that nature at the time. We had professional athletes using them. And then the health system that I work for, we have a very large Center for Integrative Medicine. I'm the medical director of wellness. It's a $5.2 billion a year health system. Prevention and wellness makes up 1/4 of our budget. So, you know, I'm responsible for over $1 billion of our budget, which is related to prevention and wellness. We just had a Harvard Medical School out 2 days ago with the Samueli Institute, looking at ways to look at prevention and wellness, looking at body, mind, and spirit. We have the very first, it was just opened about 3 months ago, organic certified hydroponic greenhouse. We feed our employees in the hospital and our patients greenery made in our organic greenhouse. And so we're very passionate about doing those things. And yes, I still see patients. I operated all day Thursday. I saw patients on Monday. I'm in my lab on Wednesday. And so I'm still very actively involved in patient care. But my role as the medical director of wellness allows me to integrate that. My role with ViSalus, which I'm obviously very excited about, has been to get the word out in ways like you saw here that we just heard from these 2 lovely ladies about how you can positively impact your health through appropriate tools, and ViSalus allows us to do that.